You call the cops, the information you share with the cops, the 911 or the authorities, even if it's in Africa, when you call for help, the information you share, it's very important, explaining to them the situation, the fact that he is mentally disabled. But do you guys think that the families should also have some kind of a resources, some kind of a help to deal with this? Because it does put a lot on the families, the immediate families that are actually trying to correct the situation or help the situation to get better.
The information you give out to the police officer, to the 911 receiver, is very crucial to actually address the fact that this person has mental illness. Have they been suicidal? Have they been homicidal before? Have they even attempted any kind of homicide? What type of weapon? Are they holding any weapon? These are the things that people need to understand. And like you said, the family is going through a lot. So that family should also have some form of counseling, some form of education in terms of how to deal with situations like this, how to be able to identify. Because most of the time you're looking at this family member as your brother, as your sister. But remember, this person is not rational. They are not the same person that you're used to dealing with. So when they're in psychosis, whatever they're seeing, they're delusional. Whatever things they're seeing, that's what they believe in. That's their reality. So just think about having someone that's really seeing someone that's out to get them and they're supposed to be defending themselves. They're not seeing you as a sister or a brother. They're seeing you as an enemy. So they're trying to defend themselves. So these are things that family members need to understand. With the police officers, they most of the time don't know how to calm a situation. So when someone is actually trying to defend themselves and you come out with a gun, if the person has a PTSD or any kind of trauma in the past that has dealt with a police officer or a military person, the minute they see that person, they already, even their symptoms are exacerbated from the fact that they see this police officer. So what are they going to do? You are not going to be able to calm them down. So there's a lot that goes on in mental health that we are not aware of. And even if you were to call, like the lady that died in Texas, she was in healthcare. She understood, but for her, this is her brother. This is someone that cannot harm her. So these are things that we need to be educated more about.
The importance of even family counseling, like you were saying, because if you are a child, let's say, or sibling witnessing this time and time again, what are you then going through, and how are you going to carry that into your life? And the parents of a person going through this, or anyone living in the household. So, if the funding is there, it's really important for the whole entire family to go to counseling.
Like you said, in Africa, I don't really think there's like funding, like once you lose your job, that's pretty much it. So how are people able to deal with it?
Okay, in terms of mental health issues in Nigeria, as I keep saying, the bonding is entirely on the family, because if you have a relation that has a mental health issue, there's no help anywhere, there's no funding anywhere. It's entirely on the family. But what I've noticed that they also have NGOs that give free mental health support to people. So if you can just access them freely, they can render their services to you, like in terms of professional counseling and all that. We just have NGOs that help, that are maybe funded on their own. Like I'm an advocate on my own. I do it freely, teach people, talk to people and all. There's no funding externally, just from the family and few people that have taken it on their own to help.
So it's not always, I think it's harder for African societies in general, because as a family also, sometimes the family is also trying to hide the fact that this person is mentally unstable, because they don't want people judging the whole family. So what end up happening is, like Sylvain said earlier on, they lock you up in a room and think they can heal you from inside that room, versus just accepting the fact that this is just an illness, and it's just, I can't say that it's normal, but it's normal. Like, it's okay for someone to be sick. It's okay for someone to seek help. It's okay for someone to be going through these things. There is no need to be ashamed to keep this person away from society, lock this person up in a room, or try to hide or stigmatize these things. It's okay.
There's not one single family that's watching this video, or not one single household that would watch this video that has not had a family member or friends of a family member or family member of friends, right, that this has affected. And even to a point of, even in the United States, in the West, even celebrities there are a lot of them that deal with mental health issues, that they all sit on it. And we all do it as a culture, as a community. So if we all want to be honest and say we want this to no longer be a taboo, no longer be something that is that we hide, and it's something that we want to face right on and deal with it and allow everyone to see it as something that you can be ashamed of. The same way someone is diagnosed with cancer, the same way someone is diagnosed with diabetes, like Ole and all of you all said, is the same exact way that happens with the person that has mental illness. But for some reason, society refuses to step up, to make this no longer something that we all point from distance.
20% of the population in the world is going through mental health issues.
Right. 1 in 5.
That's
right.
one in five. So no household, absolutely zero household is going to say 100% of my household. You probably just don't know it. You probably think, because like I said, it's not a one size fit all. Not everyone is going to go through it the same way. Okay. I could go through it a different way. I can seek help and get help, and I could go to therapy and get and be on my medication, and I'll still be fine. I'll function normal.
Every single household would have at some point in their lifetime, whether it's me, whether it's you, Juka, Ole, you may have symptoms of depression. You may withdraw from society. You may lock yourself. You may deal with situations. There is situational depression. There are definitions of the diagnosis of depression is multiple. There is major depressive disorder. There is major anxiety depression. There is situational depression, just from one issue happening in your livelihood that has distorted your normal way of functioning is actually a mental illness. When the World Health Organization comes out with those statistics, there is a basis for it. So to come back to you, Juka, it's actually very factual. In my house, just in my house with my 3 kids, I would say one of us would have some symptom of mental illness, whether it's ADHD, whether it's anxiety or depression. So within our family, you would also have one of us would have either a situational depression or a major depressive disorder or an anxiety disorder. But I just want every individual out there to understand mental illness is just like the diagnosis of diabetes, high blood pressure, cancer. Okay, it's just a mental disorder that happens. It's an imbalance that happens in the mental state of the person that make them not be a rationalized thinker at that point. It's a hormonal imbalance itself. That's why you have people that are like Stacey can totally agree with me, postpartum depression, because at that state, there is so much hormonal imbalance that happens. You just had a baby. Your body is trying to fix itself between having a baby, not having a baby. There is one hormone that's higher than the other. So your body is trying to fix itself. So depending on that individual, how much they can tolerate a situational change will determine whether they go into postpartum blues or they go into postpartum psychosis. So just because you are going through some issues because of some kind of an imbalance that happens, whether it's a serotonin level or whether it's a dopamine level, whatever level that is off, you're supposed to be at a balance.
Like you have celebrities that deal with these issues, many of them, I could name 10 of them right now, that each one of you guys will know, but not single one of them is coming forward, putting their face onto this illness to say, let's move this forward to another level so people can feel okay to come out and say that this is what's affecting me. This is what is affecting my family, so that it could be normalized and not stigmatized.
We all know someone that has gone through something. Everybody does. Everybody has someone in their family. And I do want to say, if anything positive almost from the pandemic that we're going through, what I'm seeing personally in my practice and everything is more people coming out, more people talking about how they are stressed. It is being normalized because everyone really is feeling this anxiety and the depression. And I think it also stems from not being able to be social. And that's a huge one too with mental illness, to be around people that love you and care about you, your sisters, your family. And that is so helpful. And we're in a situation now, a lot of people where because we're quarantined or the social distancing, we can't be around people. And it's worse. And people are feeling it in all aspects of their lives, which is awful. But they're also coming out and getting therapy, whether it's teletherapy or whatever it is, and they're talking about it more. So in a way that's positive, but you alone are doing so much to get the word out there, to normalize it, to destigmatize it, all of you. And it's so important.
Working and trying to survive. And as we all know, like in the US, you have to pay taxes and your bills and all of that ends up being stressful, but you also have family back home, right? That you have to care for. A lot of us do. So that's also an additional stress factor. So I think us as immigrants too, a lot of us like deal with a lot of stress, and a lot of us just keep it within ourselves, because I think in general as Black people, we tend not to, oh, you don't really need a therapy. But a therapy is just a doctor. So you have to go to a medical doctor to actually get help. So that's the same thing with mental health. You may try to, maybe there's a self-help stuff that you could do, but there's going to be at some point that you can't manage all these feelings, and you just have to seek help and talk to somebody. And that does not mean you're crazy. It just means, like what Stacey mentioned before, you're not the disease. You're not bipolar. You have it. Like, it does not define you as a person.
This 2020, I really saw a lot of change. Unlike before, people cannot actually come out to say, oh, I'm depressed, I'm undergoing a mental health issue, or I'm having substance abuse, I want to change. But this 2020, I'm seeing a lot of people come out. And in telemedicine, I'm able to see people that offer phone counseling to people, a lot of NGOs. And again, there are people presently in Nigeria, in the Nigerian government, we have a mental health bill. And I know that when that bill is passed, it will be able to help a lot of Nigerian citizens that are having issues with mental health.
And in terms of laws that are around mental illness, like I know Dr. J earlier, you spoke about how if they put you on hold or not put you on hold, depending on how suicidal or what things go on with that person. What do you all think about the laws that are around mental illness, whether it's in the West or in Africa, affects the families to get the treatments that they need for their family members or for their loved ones that are mentally affected or disabled?
So when you talk about laws, Duka, most of these laws were created to actually protect the mentally ill. Because back in the days, like in the 60s and the way before, just like what Silverlane said earlier, some of the family members would lock these individuals to help them out because that's the only resort they have. So some of these laws, when these people come to the hospital or when they go seek help, we try to protect these people as to say, okay, we're not going to keep you against your will because some family member comes in and say, oh, she's unstable, or she's sick, or she's ill, or she's crazy. Because back in the day, when they're in psychosis, instead of helping them, they'll be locked up in these mental institute. And that's where these laws came from. That's why before an individual is actually admitted against their will in a hospital or in a mental institution, they have to be suicidal or they have to be homicidal. That means they have a threat against other individuals. That's the only reason why they will be kept against their will. If they can carry on a conversation and deny any of these symptoms, then that individual will be let go. And you have to take this person to court before and let the judge decide, is this individual mentally unstable? So it takes a lot of factors before this person will be institutionalized, before they'll be put in a hospital and treated.
Even before they get an episode, does it make sense to have that person maybe sign over that, okay, once they have an episode, you as a family have the legal rights to make the decision for them? Like, is that not an option?
So medical power of attorney or power of attorney in the United States, we should all have it, regardless of whether you have mental illness or you don't. This is just going to say, in case you are incapacitated of making a decision, a rational decision, then that person is able to come in your place and speak for you. Okay, this is the very fine line. So when someone has mental illness and they come in and they need help, at that point, as long as they can carry on a conversation that is rational, they are not incapacitated. So they still have a right to make a decision at that point, whether they signed the medical power of attorney way before or not. So it's up to the medical provider to determine, is this person in psychosis? Are they able to make a rational decision? If they're able to sign a consent for their own treatment, then at that point, they are able to be discharged home. So if the medical provider can assess and document and say that this person does not have the rationale to make a decision to consent for any kind of treatment, surgery, whatever it is, then that person is kept in the hospital. So if the person voluntarily wants to be committed, that means they voluntarily wants to be admitted, then the person will be admitted. If they don't, then you have to let them stay in until they can meet a judge and then go to court, and then the judge will say, okay, we need to admit you.
If the person goes into the hospital, right, with the family member, and he sounds okay to what you said from how you assess the person as from a doctor's perspective, he sounds okay, he's not a threat to himself. He says he wants to leave. Do you most likely let him go?
Yes, if the person is rational and they don't meet the criteria for
So then if that happens, but you know this person needs help, and in order for them to be helped, you have to go through the court system to get a court order for you to be able to go back to the hospital. So this is the stage that I'm saying is very crucial. And this is the most crucial stage. I think the laws have to do something, doing it to protect the mentally ill, but at the same time, they're not also helping the mentally ill that the families want to step up to help them.
It's very difficult because some of these individuals, they're not in irrational state continuously. They may come in and out of those stages. So I think when the laws are changed, maybe they should rely on the family a little bit more and see how much the family has been involved in the past. Is the family's been there from day one? These are things that maybe if that is documented, it may be helpful. So it's very difficult sometimes, even on the provider themselves.
In a lot of instances, someone will be hospitalized, they'll be medicated, they'll be on the proper medication. And because they're smart, you know, they feel like, wow, I'm doing okay now, even though I'm medicated. And then they go off their medication because they think, oh, I feel fine, I'm doing great, I don't need this medication. When in actuality, they need that. And again, they go off it. And then you're kind of back in that cycle again. So that's why it's important to go to therapy, continue to see the psychiatrist to make sure your medication is taken appropriately, taken the correct dosage, so you don't constantly have to be vapor acted and have all these situations.
The question here now is, once you get on medication and you have a certain dosage of medication that they put you on, are you going to be on medication for the rest of your life, or can this change?
So if you're young and you're growing or you're changing or a million different factors, your medication needs to be monitored and changed. Maybe you need less, maybe you need more, maybe you need a different type of medication. Again, to just go off cold turkey is always something you shouldn't do. It's a gradual getting off of it, but it really just depends on the person, what they're going through, and a lot of other different factors.
So the answer is get monitored and get the help, the professional help. Don't just go off of it.
Exactly.
So it's always good to talk to your provider if you're having worsening symptoms, to see if medications can be adjusted or changed. If you have an improvement in symptoms and you don't need as much, you may be slowed down at a lesser dose. So these are things that need to be discussed by the provider that's taking care of you. And the more counseling you have, you may even end up needing less.
What are some of the solutions in terms of resources that we can actually use to help people that are suffering from mental health illness?
So as a mental advocate in Nigeria, the number one thing I promote is advocacy, because people need to be aware. Like most things you guys discuss here in Nigeria is totally different, because we don't even have a mental health law. We don't have any law that is guiding people. It has to just do with what your family can offer you, what the community can offer you, and what social media advocates. That's why we speak out. You try to advocate, use your Twitter handle to promote mental health. In your school, you're talking about it. Even when you're in online WhatsApp group, Telegram, you're sharing about people's mental health, telling them, oh, be aware, even if you're passing through all these things, if you need people to talk to, I'm here. Then in your family, you're also watching out, like because of I'm a mental health advocate around my community, if I just see a signal like, oh, I will just say this person is undergoing depression, I try to talk to the person or connect them to professionals that can work with them. So advocacy is the main thing. When you're undergoing a mental health issue, it is not a spiritual problem, because our society is so religious. Everything is attributed to religion, spirituality. It is a normal illness, just like your diabetes, just like your hypertension. The way people go to lab in Nigeria to say, oh, do me test for malaria. Please, if you have a mental health issue, you're depressed, they are professionals. Just go there and talk to somebody. Go to any psychiatric hospital, tell them, oh, I'm undergoing this. I think you'll be linked to a professional.
We talked about psychosis a lot, which is prevalent, but it is more rare than regular mental illness, which is the anxiety, the depression, even just the everyday stress that almost, like so many people have. And the truth is, when we have anxiety, we're thinking about the future and the what ifs and the, oh my goodness. When we have depression, we're thinking of the past and, ruminating on the past. So the goal really is to be mindful and to be in the present. Of course, that's easier said than done, but it's important to ground yourself and do that every day. And grounding is really using your 5 senses to keep yourself in the here and now. Yes, of course, it's okay to think about some things in the future, saving for the future, tons of things in the future, but for the most part, to be in the moment and to be present. And I think social media and all of that, the news kind of pulls us away from that and causes anxiety and causes more stress and perhaps depression. So, for example, with grounding, it's important to start with a deep breath. And I know it sounds trivial and we breathe all day, but are we breathing to help with our anxiety? I don't know. It's breathing through your nose. It's making sure that air gets into your stomach, not into your chest, breathing fast, because that's making you more anxious. It's getting that air all the way into your stomach, holding it, telling yourself something positive, and then breathing slowly through your mouth. So doing that as much as you can attaches to the vagus nerve, which really slows your heart rate down and really helps you be less anxious. And then at that point, ground yourself. 5 things you can see in your immediate vicinity, maybe 4 things you can smell, 3 things you can hear, 2 things you can touch, maybe something you can taste, just to get yourself in the present moment, to get your thoughts out of that anxious or depressed kind of place that you were.
Maybe you fall asleep, Stacey, right now.
Oh no!
It was therapeutic. It was wonderful.
It's so important. Are you getting enough sleep? Are you eating enough fruits and vegetables? Are you keeping with your routine? Are you exercising? Doing all those basic things, which are the basis of your mental health.
Well, we should be aware, educate ourselves so we can recognize the symptoms. I see a lot of patients that will come in and tell me they're not feeling well or they cannot sleep, which most of the time people just can't sleep because they're anxious or they're depressed or they just don't have interest in doing things that they love to do before, or they're very irritable. And family members, just be aware, if someone is irritable, those are symptoms that you can actually look into and do your yearly wellness exams with your providers. So the things that if you're not actually willing to talk about, they can dig it out of you and talk about it. And I think that should be things that we should respect in doing on a yearly basis.
Okay, thank you to Stacey for giving us your time, and thank you to Silverlyn for giving us your time also, and just engaging in this important discussion, because I know it's dear to your hearts and it's dear to our hearts too, and to the audience that are watching also. And if you guys have any last words that you just want to share with us and our audience, that would be great.
Well, thank you so much for having me. It's been such a pleasure, and I appreciate so much what all of you are doing. I guess the one last thing I wanted to say, that self-care isn't selfish. So if you're a caretaker for someone who's going through mental illness, or if you're going through mental illness yourself, take care of yourself. Engage in self-care. Self-care can be taking a walk. Self-care can be reading a book. Self-care can be listening to music. Self-care is anything that gives you pleasure, and it's not selfish.
My last word is to my African and Nigerian audience: please be your brother's keeper. Mental health is real in Africa. Last week, I lost somebody to suicide. So please, it's real. If you're watching this, please just try to educate yourself, no matter your profession. I'm a nutritionist, but today I'm a mental health advocate because I've seen how it affects my society. And if you're watching this, please, I'm urging everyone that has watched this video, please educate yourself on mental health. Be your brother's keeper. Please watch out for signs of depression, signs of suicide, and offer help. Sometimes you say, oh, where can I get help? Just use Google and say, maybe mental health NGOs in Africa, mental health NGO in Nigeria, in your country. Google it, please. If you see someone undergoing depression, any sign of mental health, and you cannot personally help the person, please, you can refer the person to help. Be your brother's keeper.
We're very sorry for your loss that you just mentioned. And I'm sure every day there are a lot of people we lose to suicide because of mental illness. So it is real, like you said, and it's between life and death for a lot of people. Everyone that's watching, please go ahead and share this video. Of course, we appreciate all the likes and comments as you continue to watch our shows, but please share this video with your audience, because everything that everyone discussed here, particularly the specialists, Stacy and Silver Lane, we really, really appreciate you all. And all the information that you've shared, and Dr. J as well, has been really, really enlightening. So we hope that you also do your part by sharing the video as you watch it right now. And we will move on to the next segment of the show. But before that, we'll say goodbye to Stacy and Silver Lane. Bye-bye. Thank you guys.
Bye-bye.
Thank you.